One day you're crossing off your to-do list, feeling like yourself again. The next, even getting out of bed feels impossible. This is the unpredictable rhythm of fibromyalgia, a condition where good days and bad days can swap places without warning. Scientists now understand that this roller coaster isn't imagined or exaggerated. Fibromyalgia exists on a spectrum, with pain and symptoms that can shift dramatically from person to person and even from one day to the next. Recognizing this spectrum is key to validating each patient's experience and tailoring care that truly fits. In this video, we'll explore what it really means for fibromyalgia to exist on a spectrum and why understanding this can be life-changing. Whether you're newly diagnosed, supporting a loved one, or just trying to make sense of your own symptoms, knowing where you fall on this spectrum can help you better manage your condition, advocate for yourself, and feel less alone. Fibromyalgia is increasingly recognized as a condition that exists on a severity spectrum, meaning it affects individuals differently in terms of pain intensity, functional limitations, and associated health challenges. Researchers like Dr. Daniel Claw emphasize that differences in central sensitization, the brain's amplified processing of pain signals, explain why symptoms can range from mild discomfort to life-disrupting agony. This spectrum model helps validate patients' experiences and guides personalized treatment approaches. Symptom variability and severity levels. Fibromyalgia symptoms vary dramatically between individuals. Some people experience mild, intermittent pain, 2 to 4 out of 10 on a pain scale, that allows them to maintain daily activities with adjustments, while others endure constant, severe pain, 8 to 10 out of 10, combined with crushing fatigue and cognitive dysfunction, often referred to as fibro fog. In addition to pain and fatigue, many people report heightened sensitivity to light, sound, and temperature. Symptoms can also fluctuate significantly over time, often triggered or worsened by stress, hormonal changes, weather, or physical overexertion. This dynamic nature underscores the need for ongoing monitoring and flexible treatment strategies. Researchers classify severity using tools like the Fibromyalgia Impact Questionnaire, FIQR, which scores patients from 0 to 100 based on physical function, symptom intensity, and quality of life. Mild cases typically score 31 to 45, moderate cases 46 to 65, and severe cases above 65, though some sources use slightly different cutoffs. The FIQR and similar tools are valuable not only for diagnosis, but also for tracking symptom changes over time, allowing for more responsive adjustments to care plans. We have added a link to the Fibromyalgia Impact Questionnaire to the description below. For diagnostic criteria, see the American College of Rheumatology guidelines, also linked in the description below. Dr. Daniel Claw's central sensitization model. At the core of this spectrum is the concept of central sensitization, where the nervous system becomes hypersensitive to stimuli. Dr. Claw compares this to a volume knob in the brain being turned up too high, making normal sensations feel much more intense and painful. The setting is not under the person's control, and it explains why people with fibromyalgia experience more pain than others from the same stimulus. To break this down more specifically, think of the volume knob at 3 different settings. Mild. The volume is slightly amplified. Background noises become noticeable. Moderate. Everyday sensations feel overwhelming, like music blasting at uncomfortable levels. Severe. The system is in overdrive, similar to a fire alarm constantly screaming. This model explains why treatments need to address neurological hypersensitivity and not just pain in the body. Recent research also suggests that genetic predisposition and early life stress or trauma can increase a person's risk of developing central sensitization and fibromyalgia. This highlights the complex interplay of biological, psychological, and environmental factors involved in the condition. Health problems that often co-occur. People with more severe fibromyalgia often have several other health conditions at the same time, while those with milder fibromyalgia may have just 1 or 2 additional issues. Mild cases might also involve tension headaches and anxiety, while severe cases frequently include 4+ additional diagnoses like irritable bowel syndrome, ME/CFS, hypermobility disorders, and treatment-resistant depression. These overlapping conditions create a domino effect where poor sleep exacerbates pain, which worsens mental health, creating a cycle that's harder to break in advanced cases. Migraine, TMJ, and autoimmune symptoms are also frequently reported, further complicating the clinical picture and sometimes delaying diagnosis. Personalized treatment approaches. Treatment plans should reflect a patient's place on the severity spectrum. In severe cases, a multidisciplinary approach is often required, involving pain specialists, psychologists, physical therapists, and occupational therapists to address the complex interplay of symptoms and improve overall function. Tracking symptoms with apps or journals can also help identify patterns and effective interventions. Patient education, self-management strategies, and support groups can also play a critical role in improving outcomes and quality of life. The Curable app is an example of how digital tools can enhance this process. Designed specifically for people with chronic pain conditions like fibromyalgia, it uses science-based education, brain training, meditation, and somatic tracking to help users manage symptoms and retrain pain pathways. To try the Curable app free for 6 weeks, click the link in the description below. It's important to remember that finding the right combination of treatments is often a very personal journey. What works well for one person may not be as effective for another, so a certain amount of trial and error is usually needed to discover what helps you most. This process can sometimes feel frustrating, but it's a normal and expected part of managing a complex condition like fibromyalgia. While doctors and therapists can offer valuable guidance and support, lasting improvement often requires a willingness to try new approaches and maintain an active role in your own care. With patience, self-compassion, and persistence, many people are able to find strategies that make a real difference in their daily lives. Understanding fibromyalgia as a spectrum disorder. Fibromyalgia isn't a one-size-fits-all condition. Symptoms and severity can vary widely from person to person and even from day to day. Viewing fibromyalgia as a spectrum disorder helps patients and clinicians better understand, manage, and personalize care for this complex illness. Understanding fibromyalgia as a spectrum disorder can reduce guilt. Fluctuating symptoms are part of the condition's biology, not personal failure. Improve care. Doctors can match treatments to neurological severity rather than using a one-size-fits-all approach. Offer hope. Early intervention, especially for pain amplification, may prevent progression to severe stages. This perspective also reduces stigma, encourages more compassionate clinical interactions, and supports ongoing research into targeted therapies. Early recognition and intervention may help prevent escalation of symptoms and improve long-term outcomes. Fibromyalgia affects everyone differently, and its symptoms can change in severity over time. Understanding fibromyalgia as a spectrum disorder helps patients and healthcare providers work together to find the right mix of treatments that fit each person's unique needs and life circumstances. Recognizing the wide range of experiences that each person with fibromyalgia has also reduces stigma and encourages early intervention, which can help prevent symptoms from getting worse. Ultimately, this approach offers hope for better management and a higher quality of life for people living with fibromyalgia. If you found this video helpful, make sure to check out our other video, Fibromyalgia Breakthrough, the simple science behind the pain, linked at the top of your screen and in the description below. In this video, we explore the groundbreaking shift in how the medical community views fibromyalgia. No longer considered a mysterious or controversial diagnosis, fibromyalgia is now firmly established as a legitimate chronic pain condition with a specific underlying mechanism. If you received value from this video, please like, comment, and share, and don't forget to subscribe so that you don't miss out on future videos.